All right, today we're tackling something that's incredibly common, but as it turns out, really misunderstood. We're talking about urinary tract infections, or UTIs. And you might think you know the deal, but trust me, there's a whole hidden world going on inside our bodies that is going to change how you see this. So let's just start with a number. Take a look at this, over 50%. It's a huge figure, right? But what does it mean?
That's the percentage of all women who will have to deal with a UTI at some point. Let that sink in. More than half. That makes it one of the most common bacterial infections on the entire planet. And get this, 1 in 3 women will have one before they even turn 24.
Now, we usually think of a UTI as a simple problem. Annoying, for sure, but simple. But what if I told you the real story is way more complex? The science is pointing to a picture that changes everything we thought we knew. So let's dive right in. First up, we're going to challenge a very old medical idea and find out what's really going on inside the bladder. For decades, the thinking was that the bladder is a totally sterile environment, like completely germ-free. Well, that's just wrong. It turns out, just like your gut, your bladder has its very own microbiome, a whole community of bacteria that are just there, living their lives.
And this is a really crucial point. Just having bacteria in your urine, the technical term is bacteriuria, is often perfectly normal. It does not automatically mean something is wrong.
So when is it a problem? This is where it gets interesting. The real clue isn't the bacteria themselves, but the presence of white blood cells in the urine. This is called pyuria. Think of it like your body's alarm system. It's a sign that your immune system is gearing up for a fight.
And when that alarm goes off, plus you get all those classic miserable symptoms, the burning, the feeling like you have to go constantly, that's what doctors call cystitis. It's the clinical name for a classic bladder infection.
So let's put this all together, because this is maybe the most important concept to get. On one side, you have colonization. Bacteria are there, but your body's cool with it. It's harmless. On the other side, you have an infection. The bacteria are there and your body is sounding the alarms. And telling the difference is so important because needlessly treating harmless colonization is a huge driver of antibiotic resistance.
Okay, so how does this peaceful community of bacteria sometimes turn into a full-blown attack? Well, it's time for us to meet the main offender.
Yep, here it is, the prime suspect, E. coli. This bacterium normally lives harmlessly in your gut, but it's responsible for a staggering 85% of UTIs that people get out in the community. It is the undisputed champion of bladder infections.
Now, here's what makes these bacteria so darn persistent. Some strains of E. coli are like master architects. They can actually invade the cells lining your bladder and build something called the biofilm. You should think of it like a microscopic fortress. It's a protective shield that helps them hide from your immune system and from antibiotics, which is why some infections can come back again and again.
So if the bacteria are building fortresses, how do we fight back? Well, our main weapon has always been antibiotics, but as you can probably guess, that weapon is facing a huge and growing problem.
For a simple, one-off UTI, the treatment is usually pretty straightforward. Doctors have a few reliable first-line antibiotics they turn to, and as you can see, the treatment is often really short, just a few days. For most simple infections, they work great.
But here's the catch. For years, we've often used really powerful broad-spectrum antibiotics for these simple infections. It's basically like using a sledgehammer to crack a nut. And all that's done is helped create antibiotic-resistant bacteria, turning what used to be a simple problem into a much tougher enemy.
And this leads us to one of the most frustrating parts of this whole story, the fact that UTIs love to come back. Why do some people seem to get stuck in this awful cycle?
Well, this isn't just a string of bad luck. There's a clinical definition for it. If you have 2 or more infections in 6 months, or 3 or more in a year, it's officially classified as a recurrent UTI, and that's when it goes from being a nuisance to a chronic medical problem.
All right, you knew this was coming. We have to address the elephant in the room. The most famous piece of UTI folk wisdom of all time. Does cranberry juice actually work?
Well, I hate to be the bearer of bad news, but the science is pretty clear. Despite being super popular, major reviews of all the evidence have found there's just not enough solid proof to say it actually prevents UTIs.
Okay, let's tackle another really common question, one that carries a lot of unnecessary guilt. For people who suffer from recurrent infections, they often ask themselves, am I doing something wrong? Is this my fault?
The answer, let me be very clear, is a resounding no. The source material is emphatic here. This is a biologic phenomenon, not a result of poor cleanliness. It's about your individual biology, your genetics, your specific microbiome, things that are totally out of your control. It is not about your hygiene habits.
So far, we've mostly been talking about the bladder, but what happens if the infection isn't stopped there? This is when a UTI can get a lot more serious.
The bacteria can actually start to travel upstream. From the bladder, they can move up the tubes called ureters and into the kidneys. This leads to a much more severe infection called pyelonephritis. We're talking fever, serious pain. It's a whole different ballgame and can be very dangerous.
And all of this brings us to one final, really critical question. We've seen that the bladder isn't sterile, that not all bacteria are bad, and that our best weapons are starting to fail. So, looking ahead, the challenge is massive. In an age of growing resistance, how are we going to treat one of the world's most common infections? That right there, that is the unseen battle that we all have a stake in.